Dr. Jack Hahn, implantologist and principal designer of the Hahn Tapered Implant System, has been placing implants for more than 45 years. His design innovations, including the original tapered implant, have played a key role in making implant therapy the predictable mode of treatment it is today. But the pace of innovation continues. After the original tapered implant came out nearly 20 years ago, Dr. Hahn continued placing and restoring implants in his busy practice, completing thousands of cases. This experience resulted in clinical observations that would serve as the basis for a new implant design that simplifies treatment and increases case efficiency. The Hahn Tapered implant has been precisely engineered to meet the demands of modern implant dentistry. With a streamlined surgical protocol, sizes for every region of the mouth, length-specific drills, and a thread design that allows for swift insertion, precise control during placement, and exceptional primary stability.
When I set up the first hands-on program in dentistry, I selected a faculty of internationally known people. And Jack Hahn I asked to help with this hands-on surgery thing. Our lectures are, let me make your job easier, let you show you what's working for us, let's decrease your complications, and he's got that style too. His implant design was made from a surgical perspective to make it easier to put in. He's got a very unique approach. Your drills go in easier.
It is simplified the surgical and the prosthetic protocol immensely. With the Hahn system, each implant has a specific drill, a final drill. So you don't need drill stops. You don't have to look at the black lines. It makes implants so easy.
When utilizing the Hahn system, the nice thing that I found with the drills is that they're length specific, so you're never going to over drill the preparation when preparing for an implant site. The Hahn surgical kit is laid out in a very systematic way. It's easy for the general practitioner to utilize.
The implant will self-drive itself, self-correct almost, and in the hands of a beginner or a good operator, you can feel that, and that comes through.
The fact that he makes it tapered, major advantage. It makes it easier, a little bit more predictable as far as the final site.
It's a tapered implant, which is very, very easy to insert. With the tapered implant system, you have the ability to place it into more confined spaces. So if you have areas where the teeth are converging, it makes it very, very nice for those situations. The primary stability is excellent. It's probably the best thread design I've ever seen. The primary initial stability of the implant makes it so easy to place implants in immediate extraction sites or in previously grafted sites or very poor bone density. It is excellent for the full arch edentulous patients for like a monolithic zirconia prosthesis.
It's got a nice aggressive thread pattern. I like having that initial stability that the Hahn implant affords me and affords my patient in my practice, doing a lot of all-on-4, all-on-6 style presentations to my patients.
I like to utilize the Hahn implant system, especially because it's actively threaded and the taper form allow you to place an immediate implantation or immediate extraction sites.
This is a much easier product to get, and especially if you're taking out a tooth and putting in the same time. Don't even try using the previous product.
In my practice, we do a lot of extractions in immediate load cases. Having an implant like the Hahn allows me to utilize this aggressive thread pattern to get that initial stability, to place a temporary cylinder and start molding the tissue from the very get-go by placing a temporary restoration as it comes all the way from a 3mm diameter up to a 7mm diameter. I love the 3mm diameter implant for laterals because I can ask Glidewell to fabricate for me a custom abutment out of zirconia to a titanium base for aesthetic results in thin areas like that. The other thing is it goes all the way up to 7, so an immediate implant for a molar that I've just removed on a lower arch becomes much more predictable.
With the Hahn implant system, with the packages that you have, they get a full array of implant sizes. Because of the pricing with the Hahn implant, it's very, very economical for the doctor to have a full inventory in their office.
The platform switch in the Hahn system gives you a great tissue response and a good healthy amount of tissue so that when you restore it, the tissue is pink and healthy and we don't have any major blanching or discoloration. Aesthetically, these restorations look lifelike.
The platform switching allows us to have the hard and soft tissue maintained at the crestal area. The soft tissue is better at the implant abutment junction, which makes a less chance for having peri-implantitis or periodontal problems post-operatively. Different cases that I've been doing with the Hahn implant system is a full array from single tooth implants to full arch restorations, and it's definitely the easiest system I've ever used. Based on my experience with the Misch Implant Institute with doctors coming early on their learning curve, one of the areas of concern for a lot of doctors is the initial cost to get involved with implant dentistry. What the Hahn system has done is it's changed that. They have unbelievable pricing packages for the doctor.
All implant systems have one item that really works well. The interesting fact of the Hahn system is that the implant itself has 5 or 6 items that make it just absolutely outstanding.
With the Hahn system, I'm able to utilize it for a variety of different cases, whether it's immediate load or two-stage surgery. The Hahn is a very economical implant that allows you the capability to implement implantology in your practice, whether you're a general dentist or a specialist.
The Hahn implant, to me, is a very premium product at a very value price point, giving me what I need to feel comfortable that my patients are getting a quality US-made product at a very affordable price.
This is so much farther ahead than anybody else. You're going to go to this product. And I haven't had one person that switched over that didn't say, I'm glad I switched over.
Well, I don't want to give my age away, but I placed my first implants on March 9th, 1970. I'll never forget that date because it had such a big impact on my life. It was such a high for me to think that you took something that nature took away and you give a patient back comfort and function, a quality of life. I narrowed my practice down to just implant placements and implant prosthetics. That's all we did. Implants in the morning, prosthetics in the afternoon, and to this day, that's what I still do. When you've been placing and restoring dental implants as long as I have, in the numbers that I have, you've seen what works and what doesn't. You've seen how to speed delivery, preserve bone and soft tissue, and ensure an aesthetic outcome. What I tried to do is not to reinvent the wheel, but take what science proves to be good and incorporate it in the system, and the things that science proved not to be so good to eliminate. Some of you may know me as a pioneer of emergency placement and immediate loading concepts, or as the inventor of the first tapered implant design that grew to be one of the most widely used in the world. It works good, we get some good primary stability, but not as much as I would like. My objective is always to improve, to see something that we can make better. So we come up with the Hahn implant. We wanted to keep improving. That's what we've done with the Hahn Tapered Implant, combining more than 40 years of clinical experience with the state-of-the-art equipment and the latest manufacturing processes. We produced an implant system that makes everything easier with sizes for every region of the mouth, matching drills, and thread design that keeps the implant right where you want it during placement. Now, the response from practitioners that have placed Hahn implants has been phenomenal. They've sent me emails, some have even called me and said, I love your implant. Misch has designed and placed thousands of implants. He's written many textbooks. He's contributed more to implant dentistry than any one person in the world. And to have him say he likes it and endorses the implant, it's just such an honor for me at my stage of my career to have the seal of approval from the Misch Institute. So when people say, well, tell me about the Hahn implant, I just say, well, the Misch Institute has adopted and endorsed it. And that's all I need to say because of his reputation. I've placed and restored over 600 Hahn implants. The response has been phenomenal. We've seen wonderful results with x-rays. The soft tissue response has been great. It's quite simply the best implant system I've used. So I'm excited about it because I think that we've got something that I can put my name on and be proud of and have doctors call me and say, Jack, I love the implant.